wild stuff. But we'll see how it goes. Doing better than the Jags, anyways.
Yeah,
I told you there was going to be moving on that receiver.
you know what? I can't blame Calvin Ridley for taking that money, but it definitely definitely put a damper on things for certain. Um, we're gonna have to draft somebody at this point. We'll see. I'm hoping we can get Keon Coleman from Florida State.
This is a wasted season for the Jags. This is going to be a wasted season. You're Jags trying
Ah,
to figure out if they're going to move on from Trevor Lawrence or not. It's going to be a wasted season.
well, we brought the hometown hero Mac Jones back. And that
That's what
he
I'm saying,
did
man.
you know he's from here? He played at Bowles.
No, I didn't know he played at Bulls.
Yeah. Yep, he played at Bowles. He lived in Mandarin.
Oh, wow.
Cool.
That'd be nice for him to be back then. At least they'll have all the Bulls boosters there.
Yeah, I know.
They were
I know.
probably going anyways.
We'll see. I think it's a good insurance policy, and like you said, if Trevor doesn't work out, he could
Test out and
he could
test
take it
out
over,
somebody cheaper.
right? All right, so it's 1:35. We'll go ahead and get started with our usual
Yeah.
trivia question. Jose, I'm going to share a screen. Just let me know if you can see.
We go. Yep.
Awesome. So today's trivia question is: which of the following is exempt from signing a business associate agreement? Now, for those of you that are joining in new, we did talk last week about business associate agreements, so this is sort of a question related to the same. Again, which of the following is exempt from signing a business associate agreement? And the choices are A, IT service companies, B, EMR, EHR providers, C, medical billing companies, or D, janitorial custodial services. I see we got Dr. Headley in here today.
Ooh,
Dr. Headley, you know the answer? Test out the chat. Let's see if it's working. All the
all of
above.
the.
When in
Well,
doubt, all
that's
the
definitely
above.
wrong.
Brenda, would you like to take a stab at it? Going once, going twice. So again, which of the following is exempt from signing a business associate agreement? The answer is actually D. Janitorial custodial services are exempt from signing an agreement. Again, janitorial custodial services are not considered business associates because they work and perform for covered entities, and obviously their line of work that doesn't involve use or disclosure of protected health information. So D is your answer. Sorry, Dr. Headley, it's not all the above today. Jose, you want to add anything to that?
The
Okay.
technical term you're looking for is incidental.
Incidental. Yep. Yep.
Yes. So the custodial services are covered under incidental exposures and access to PHI. So you wouldn't have to worry about it in those kinds of scenarios.
Got it. Got it. So I got the presentation up, and we'll go ahead and get it going. Jose, just want to double check you can see it.
Absolutely.
Awesome. Well, hey guys, hey everyone, welcome again to another compliance step-by-step webinar. My name is Ray Walters. I will be your host for today's session. I'm also joined by our co-host, Mr. Jose Delgado, who has just a little over 2 decades of experience in healthcare consulting, owns a medical telehealth practice as well, and very keen to compliance. Also works with us with our Epi conference event, which is an in-person event that we host annually. Taking a break this year, but we will be hosting it in the near future. But one of the things that we offer through this conference is a certified HIPAA security officer training. And this is a training that, if you're an office admin, you're a business manager, You're looking to learn a little bit more, get a deeper dive into HIPAA. This is a training that we certainly recommend. Again, we were hosting this training in person, but this is a training that we are going to be offering online here very soon. Please stay tuned for that. Still looking for a deadline. I know those of you that are in here, we've mentioned this before. We're still trying to find a deadline, but it's going to be coming out soon. We may even send out a pre-registration a link as well. So again, just stay tuned for that. We'll be sending some correspondence once we hear a more of a tight deadline for that. Jose, anything you want to add?
No, I know that there's always different certification courses as well for those that are more clinically minded as well. Last time we did some diabetic neuropathy, wound care. So there's always we're always looking on a two-sided track when we do these kinds of conferences where part of it is for clinicians, part of it is for administrative, and part of it is for both combined. Because if you're starting a new program that's outside of what's covered by insurance, then you've got to figure out both sides of the piece, right? One, how to do
Sure.
it clinically and legally, and the other one, how to get paid for it. So we usually like to go over both parts of that rather than just giving you the one versus the other because different people are inclined to capture different parts of the information. So
No, good stuff. Good stuff. And obviously, Jose, I know you were out last week, but again, just to, I know we've already talked, but we talked a little bit about business associate agreements, and
yep.
obviously the importance behind those, and showcase a little bit of how EPI compliance can make that process a little simpler. Obviously, when it comes down to business associate agreements, who has the time to sit there and create their own templates or
Yeah,
shell out
it's
money to hire attorneys to create these contracts for you. EPI compliance solution makes it simple. We provide the template. You go in, fill in the blanks as to who you're sending it to. Boom. It's just like DocuSign. Business associate signs the agreement. They have a copy for their records. Copy is stored on your account for your records. You're good to go. So
perfect.
today's discussion, I wanted to sort of stick to the enhancing, I call it, or leveraging resources. We're enhancing resources. I want to talk a little bit just about the basics behind having policies and procedures in place at your practice and the importance behind that. So I want to talk a little bit about that and showcase towards the end of the presentation sort of how EPI compliance can help streamline that. Obviously, when it comes down to policies, procedures, if you're a small medical practice, what's our term, as far as the compliance officer, the office manager of the practice, they're sort of the certified firefighter. They're in charge of everything.
You're a full-time fireman and then you got to
Yeah.
do everything else. So
Yep. And then, obviously when it comes down to, creating policies, procedures, I would say it's safe to say with the amount of customers that we interact with, that it's definitely a pain point. And I think the biggest pain point is keeping those things up to date as well.
yeah.
We can skip this, or unless
Yeah, we
Jose,
kind of went over this
we
already.
did. Sorry. So again, kind of went over this. Forgive me, I'll try to keep up with the slides at this point. But again, want to discuss the importance of policies, procedures in healthcare. Want to review the components that make effective policies, procedures, and then again, I mentioned that towards the end of the presentation, want to do a little bit of a showcase on how EPI compliance can help streamline this for you and manage these policies and procedures for the practice. So Jose, were you the one that that was gonna be interviewing me today, or you want me to just go ahead and
Yeah,
jump
yeah, yeah.
in?
No, no, no. Let's do it. Let's do it that way. You just started going, so I was like, all right, I guess he
Hey,
changed his mind.
I know, I
So, I
know.
mean,
We talked about switching it up today. I think Jose was gonna ask me a couple questions, and then we'll sort of dive into it. Jose, if you got to interject, you can.
no,
Feel
yeah, yeah.
free.
So let's do it this way then. So yeah, so Ray, and I know that EPI compliance is split up into two sections and most compliance programs should be split up into two sections, the policies and the procedures. Um, how easy is it to navigate with the EPI compliance product? because as an administrator, I don't have time for this, right? Like I got to get in, get what I need, get out. So
Yeah.
how easy is it for me to
It's
find what I'm looking for?
I would say to answer that, Jose, and I definitely understand. Obviously, you want to make it as less clicks as possible, right? But no, navigating a system like Epi Compliance, I mean, the policies are essentially a click away. And again, Epi Compliance, again, for those of you that are joining us new, we cover 4 facets to compliance. This can be your general OSHA for healthcare, your HIPAA privacy, HIPAA security, and Medicare waste, fraud, and abuse. So, which we do provide online policies for. And in terms of navigation, as I mentioned, it's simple as a click of a button. There's an area, we call it forms and policies, and the way we keep things organized is by each module, right? So if you want to go in and access OSHA policy, for example, Jose, you simply click into your OSHA module, and then one tab that's called policies. we keep it simple.
Well,
You click on the
you can share screen, so show it to
yeah, no,
us.
certainly.
Let's do it that way.
Yeah, you know what, we'll do that. We'll do just a quick share screen,
Because
and
this is what we're talking about anyways.
I'll
We don't
show
need a
you guys
PowerPoint for
how
this.
simple it is. Yeah, absolutely. Let
Yeah,
me know if
let's
you.
go to, and since you're mentioning OSHA, let's just do the one that everybody in healthcare knows, the bloodborne pathogen one that
Of
everybody
course.
always knows they got to take.
Jose, are you able to see screen?
Yes.
So again, just to reiterate, guys, this is me logged in as the quote unquote compliance officer. This is my dashboard. Again, the way Epi Compliance works, everything's online, managed online, and at this day and age, you know, our goal is to keep things simple, right? Keep everything online, especially when it comes to compliance. But as far as the policies that go, again, we have a section, we call it forms and policies. And in terms of navigating here, as you can see, we organize by each area of compliance. So again, we'll just use OSHA as the example, because again, if you're a healthcare organization, everybody has to have OSHA, right? So it's as simple as clicking into your OSHA module, and you don't even have to click. Actually, the first tab that's going to open up to you are your policies. So these are all of our policies listed out here in relation to OSHA. These are listed in alphabetical order, but you can certainly filter this. Or if you're looking for something specific, there's a search bar as well. And, you know, in terms of what we provide here and in terms of these policies, you know, these aren't something that we make up here at Epi Compliance. These are all policies enacted by the federal government. We are simply providing the federal guideline for you to have access to. And as far as I'm aware, Jose, you know, when it comes down to inspections, right, or audits, they're never going to ask. And let's just use OSHA for example, right? So let's just say I'm a chiropractic office. I'm dealing with an OSHA inspection. They're never going to ask you, you know, to review the entire OSHA manual per se, but they're picking and
I want to see that you
choosing.
have one for starters.
They want to see that you have one, yes. And obviously the answer to that is if you're an Epi Compliance customer, yes, I have an online manual. Again, it does not have to be a physical manual. But what I've seen a lot of is they're coming in with a checklist, right? And they're asking for something specific. You know, they're never going to say,
Yep.
"Hey, I want to see your entire ocean manual," and they want to go through every single page of that. Not going to happen. It's going to take them too much time, right? But ultimately, you know, they're going to ask for something specific to review. You know, in other words, hey, I want to see your electrical safety policy, right?
Yep.
Again, the way we're set up here on Epi Compliance, again, you can simply navigate. It just comes down to understanding how to navigate this, but we make it simple, right? Again, a lot of the things that they're going to be asking for is going to be verbatim to what's on the system, right? Because we are providing the federal guidelines. So as far as electrical safety goes, yes, these are listed in alphabetical order, but as I mentioned, you do have a search library as well. You can search the policy. You can pull up the policy on screen. You can, again, whatever makes it easiest, you know, you can turn your computer monitor around and show the inspector, or you have a download option as well. You can download these all as a PDF document, print it, hand them a copy. Simple as that.
Cool. So, I mean, policies is one part, procedures is the other part of this. So, where would that be found for, let's say, the same exact thing, right? Because for every procedure, there's a policy behind it.
Sure.
So are those attached together? Are those attached in a different section?
There's a
How's that going to work?
couple ways to accessing the procedures, or I'm sorry, I'm sorry, yes, the procedures, right? So again, the policies are kind of the how and why. The procedures is actually the template or how to implement, right? So there's two methods that we use now. As far as the policies go, if you click into, we'll use OSHA as an example again. If you click on the PDF forms, that's going to give you the templates to these policies, right?
Got it.
But we go a little further as well. So again, as I mentioned, there's policies that sort of show you how to do things, and then the procedures are sort of the templates related to the same. We, in terms of organization, and again, our goal is to make this simple for our customers, right? Because that's ultimately what you had mentioned earlier. I want to be able to click a few buttons and be done, right? um in terms of this
Yes.
process,
As few buttons as
as
possible, as
few
quickly as
buttons as
possible.
exactly. So we've created what we call a tasking system, right? And ultimately, we link those templates in this tasking for our user, for the user to log in, obviously, and manage and complete these tasks, right? Now, I know yeah, it sounds like more work, right? But again, we streamline this process. We want to make it simple. In other words, we don't want to send our customer 200 of these templates up front, these procedures, and say, "Hey, you got to do this for us by the end of the year," right? Because then at that point, yeah, I'm going to be feeling overwhelmed. But the way we make this process simple, the way we streamline things, is we break things down on a monthly scale, right? So we send out a checklist to our customers at the beginning of each month that sort of highlight um, the action items or the procedures that we want them to go in and complete. And again, we call that tasking. And in terms of who's responsible for this on the system, this isn't something that your staff's got to go in and do. Really, the primary responsibility it's going to be on the whoever's the designated compliance officer. Is going to be the person responsible for this. But like I said, in terms of the way this is set up, I'll sort of show you just we'll use OSHA for an example, but um, again, the way we sort of have this organized, we send out a checklist each month. Again, the way it's organized, as you can see, is by each module of compliance, right? So you got your OSHA, your privacy, your HIPAA security, your Medicare. Um, doesn't matter which order you start, you click into the checklist that you want to work through, and then you'll see the task at hand, right? And then from here, you select the task. It's going to provide the instruction to you. And then from there, we provide the template at a click of a button. So it'll open up. And again, the idea is this: we don't want to go through the motions of you have to print out this document, you got to fill it out by hand, you got to scan it in, you got to upload it back
Yep.
onto the system. Everything can be done here with a click of button with your keyboard and mouse, right?
Okay.
You can open up the template. Again, it will provide you instructions. Once you're ready to submit the template, there is a publish mechanism. And then ultimately, all this documentation is going to be stored on your account in a centralized location. We call it document management.
All right. So then let's talk about um modifications, right? Because there's so many different things that you can do with a default set of forms. There are certain things that I, as a office, no matter what, I need to address. So you may have like evacuation policies, but I really should customize something like that for each and every specific location in the case of evacuations and fire safety and all that fun stuff, which we got to do anyways as an office because you got to have the little map of where the exits are and all that fun stuff. So, what do we where what do we do? How do we do that?
In terms of
So
custom,
I got to do a custom policy.
right?
Do I just grab the would it be easier to grab the defaulted one and just base the new one off of that?
My recommendation is always refer to the policy because the policy is going to show you how, right? And then
Gotcha.
it's going to show you the template, and if the template's too basic or if there's something in there that's missing, it's completely customizable. In other words, you can download these templates, and if you need to add something to it, you certainly can. There's no right or wrong to that. Like I said, Epi Compliance will provide the general template. If there's any additional customization, you have the ability to do it. Like I said, each of these are downloadable PDF documents. If you have any general PDF editor, you can go in and edit those documents. Absolutely.
Okay. And then and then let's be honest too. The human element is the part of my business that's going to give me the most headaches.
Mhm.
So, how do I not necessarily erase, but turn off the ability for my employees to view the default one so they only view the custom one?
So, good question. That's so no, good question, because again, this was mentioned in last week's webinar. We are coming out with a new version of this dashboard. So again, the goal is to make these processes a little simpler, as well as we're adding additional features. And that's one of them, right? So
Okay.
currently, yes, the compliance officer can upload policies on here, customize policies, but setting the parameters of who can view and who cannot, if you're uploading onto it depends on where you upload it. Essentially, if you only want yourself to see it, as the compliance officer, you can upload it that way, or if you upload it to each user's folder, they will be able to view it as well. But
Got it.
again, there's a lot of again, our goal is to make it simple, right? And
Yep.
there's a lot of steps involved, but essentially, in a newer version that we'll be releasing, there's going to be functionality to sort of be able to track those things a little easier. If you want to, in other words, you'll have a select all view of who you want to give that access to, etc., versus having to dump it in each individual folder.
Okay. So then if I uploaded a custom version, um, and again, let's assume that I uploaded it to the correct area, right? So, we're talking about fire evacuation, so it'd be an OSHA, or technically HIPAA security for the physical section. But let's just keep it simple. We've been talking about OSHA. Let's just stay in OSHA.
Sure.
So we would open it up there, right?
So you can do it. There's a couple methods. You can open up your module, right, and then you'll see a documents tab, and
Okay.
essentially it's a drag and drop process here. You can upload
Okay.
it. Now, if you upload here, everybody's going to see it, right? Now,
That's what you would want.
exactly. If you did not want it, then you would do it through the document manager and sort of upload it into your own folder. If that makes sense.
Okay.
So technically, the functionality is there. But we're working on like I said, the latest version, and we're working on a better means of turning off the view, who wants to view that policy and who you don't want to view the policy, etc.
Gotcha. So what kind of scenario are you guys envisioning that we would want to do something like that for? Is it specific human resources situations or
So in terms of the HR side of things, I know we met with Leah, a couple weeks back,
yeah.
and right now I guess you're referring to what, like if an incident was to occur with an
No, no, no.
employee,
Like
or
why would I want that functionality? Why would that functionality be important for me as an administrator for me to put it on here? Am I basically using this as my HR folder kind of a thing? Is that what the kind of plan is for that functionality?
essentially, like I said, it depends on what kind of policy that you want to upload here. There's, we don't necessarily do the HR compliance, but if you want to use this sort of for the same, you technically could. But
Okay.
obviously, if those are customized documents that you've created. And for example, right, I'm thinking of let's just say there was a employee termination, right, and you had them sign a document, at the end of employment, that you want to place on here. Yeah, there's, like I said, if you go into your document manager, each of your users will have their own individual folder, so you can place anything here. Like I said, termination letters, etc. And like I said, this is just testing, but test folders here. But this will list out your employee's name, and if you want to upload something for them and them only, like I said, it's a simple drag and drop process.
Perfect. So then I'm an administrator. This is a lot for me to absorb, but I'm the administrator. This is my problem at the end of the day. So when it comes to the end all user, like the end user, lowest functionality, what do they see out of all of this?
So, no, good question. I mean, at the end of the day, as far as a staff member goes, we
Yep.
limit things by permissions, right? So, the end all for staff on this system, the primary responsibility is completing those trainings, right? So, that's the biggest thing on the
No, no,
system
but
for.
what's it look like? Are all of these boxes still here? Or are there certain sections that are not here at all that I
Right.
wouldn't
So
even
we
I wouldn't even
call
know exist?
so again, I'm logged in as an account admin, right? Or the quote unquote compliance officer. I am going to
Yep.
have access to all these tools here for
Yep.
me.
Yep.
As a staff member, right? If I'm just the medical assistant, I'm going to be given a basic credential. We call it basic user. And
Okay.
that's something that when the compliance officer is managing the tool, they're assigning their staff members to the system. In other words, creating their own individual profiles. They have the option to set these permissions, right?
And
Um,
90% of your users are going to be basic users because they're not going to be actually doing much other than, like you said, having
Correct.
access and then doing the
Correct.
courses.
Their primary
So,
responsibility on the system is completing the trainings that are offered. So essentially, when they log in, yeah, very limited in terms of what you're seeing here. Obviously, by law, they need to have access to the policies, procedures. They will have
yeah.
access to view those and online. So they will have access to that forms and policies area to an extent. They're obviously going to have access to the training center as well. And
Yep.
anytime that a new employee logs into the system, they will be required to attest to a HIPAA confidentiality agreement as well,
Okay.
which is something they'll be able to sign in their message board as well, or
Now
signature
they
required.
would they also see that box that says task and communication in the business associate
That is
center?
correct. So one other thing that staff will receive as well is monthly security reminders. So essentially, what the federal government's looking for, they want to see that staff is receiving some sort of ongoing training. Which, if you're a small practice, again, if you're the certified firefighter, you don't have time to to sit there and conduct these 1 hour long meetings and essentially what they
Yeah, I
want to
mean they
see
could
is
be
hip.
10-minute meetings
Well,
still.
that,
Yeah.
yeah, we make it simple. We send out these reminders once a month as well, and yes, it'll go through the user's communication area, which we call a notification center or
Can you
announcements.
show us this
Yeah,
month's
yeah, absolutely. So
while we're here? I mean, now
um,
everybody can kind of see it if they've never looked at it before, which I
so
guarantee you.
again, these are the reminders that were sent out. So again, if you are an customer in here, you should have received these reminders. These went out at the beginning of March, and again, it's going to be on a different topic each month.
Yep.
It's always going to be HIPAA related. This one is talking about cybersecurity, et cetera. But again, these are sort of treated as ongoing trainings, right? So you no longer have to sit there and I know you said 10 minutes. Hey, 10 minutes is a lot to
I mean,
practice.
if you got to do it
It goes a long way,
monthly, like that adds up
right?
to quite a bit of time.
So, like I said, the user can simply log in. They can access their notification center. It's just like accessing an unread email address. You'll see a unread message there. They go in, they click on this message. They can review it. It's actually already marked as read. User can hit save once they're done, and then boom, that logs it. Right? They've successfully reviewed this message. But really, ultimately, that's essentially that's all the staff really needs to take care of now. Um, you
Right.
know,
Let's say I'm old school because I have a lot of
sure.
administrators that are um, a little bit older than me. Can I print that out
Yeah. No, absolutely. You can download and you can print them out as well if you want to post them in your break room or post them anywhere. Yeah, you absolutely can.
put them right beside that federal minimum wage poster? That
Yep.
way everybody can look at it when their phone's dead.
Yep. No,
And then a
that's
piece of paper right beside it so they sign their name.
yep. Hey, Carol, I appreciate you being on. We'll see you next week.
So interesting. So what? Well, what can you tell us is going to be different about the new version that you keep teasing us with? Is it going to be aesthetically different? Is it going to be like Facebook 1.0 versus Facebook 2.0, where made me want to flip the table? Granted, I'm probably aging myself right there. But
Yeah, you're making me
but
feel old
like
too.
what are we looking at here?
No, it's definitely going to be a sort of a refresh now. Some of the processes are obviously still going to be there, right? The training's still going to be there, policies are still going to be there, but ultimately, our goal is to our primary goal is to make it a little more user friendly. So it is going to have a little different look and feel. I would say the biggest thing that we're updating is our tasking, and what I mean by that is, a lot of these tasks, unfortunately, they're super repetitive, right? And that's essentially it's just how the federal government works, right? They
Yeah,
want to see that you're documenting. So, for those particular tasks that get sent out that need to be documented once a month and stuff like that, where it really are things going to change, right? I've inspected my fire extinguishers, I've inspected my emergency lights. Is it really going to change next month, right?
yeah, yeah,
Or
yeah.
you know what I'm saying. So tasks like that, it's going to give you the option to sort of auto complete, meaning you document when it pops up again, you don't have to sit there and refill out the document. It's essentially going to populate for next month, and you just sort of hit the button, as in you're confirming that, hey, everything looks good. Boom, you're submitting. So you don't have to, like I said, it's going to take the user a whole lot of less time and effort, and we're looking forward to that feature. And like I said, it's going to have a little bit of a different look and feel. Um, but ultimately, like I said, our goal is just to make these processes simpler. But I'd say that's the
Got it.
biggest thing that we worked on is the tasking,
Got it.
and
So
simplifying that.
it'll basically I won't have to refill all the information that I've already put in
Exactly,
before, but I
exactly.
still need to affirm the fact that I am doing the job.
Yes, as a compliance officer, you have to authenticate it essentially. Like I said, if it's a repetitive task, it's going to have the same information in there that you filled out last time, but you do have to click a button, right?
Yes. Well, no,
But
no, no, no.
but
That's fine. That's fine. I'm
no,
just
it'll ask you to authenticate. Hey, does this information look good? And then you'll have the option to authenticate it as the compliance officer. But like I said,
okay.
ultimately, that's a pain point on the current version, um, that we're trying to address, and I'm excited. I've sort of teased it out a little bit. I don't want to share it just yet because we're still working some bugs and some kinks out. But like I said, we will be releasing this very soon, and I'm excited.
Watch it be April 1st. You roll it out
April
on me.
Fools.
Watch. Watch it be April 1st. I'm telling you.
Stay tuned.
Just
We've
to be
sent
like,
out. I
is
mean,
it really out?
we've
Make
sent out.
everybody log in on April 1st just to see.
Right. Well, we will be hosting
Interesting.
workshops as well. We haven't been sending correspondence, and I'm sure you probably saw something come in, but we have started sending out reminders just to get everybody prepared for this change. One thing I will say is we will be hosting workshops as well. Once the new platform is released, we want to get everybody trained up as soon as possible, right? Um, so we will be hosting some workshops. So just stay on the lookout for registration links for those as well. I think we're going to
Where are those
do.
going to be uploaded to?
Well, we are going to upload them to YouTube. So if you
Okay.
missed it, not a big deal. We will have those on YouTube. We'll be sending out in tandem. We do have some tutorial videos that we've created as well, that we will be sending out. And again, if for some reason you can't attend these events, I think we're going to host at least 3 or 4 is what we're looking at. If you can't attend them, not a big deal. Like I said, we're going to record them. You can see them on YouTube, and we're also going to be sending you tutorial videos as well. So
Okay.
if all else fails, just give us a call. We do have full service
Yep.
customer service staff. We have a live chat as well. Reach out to us. We'll be happy to provide clarity. So
Cool. 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 So, um, Yeah, I mean, I imagine that some of the stuff is going to change for end users versus admin users, like location admin and license admin, all that fun stuff. Um, the mandated risk assessments, would that be on the utilities box? Would that be showing up on the end user side, or is that only on the?
You sound like you know something, Jose.
I know
No, good
nothing.
question.
I know
So,
nothing. I'm literally just
so
asking questions
as far as the
like
risk is,
like we talked about.
as far as the risk assessment stuff goes, obviously we provide a self-assessment tool. But ultimately, and I know we've talked about this in previous webinars, is your best option is to do a third party assessment. Why? Holds a little more water, it's non-biased, and you're having like I said, not saying it's you audience, but
No, no, yeah,
we have
absolutely.
a lot of customers or potential customers, whatever you want to call it. Seen a lot of organizations, they use that self-assessment tool. Uh, they tend to give themselves a higher score than they actually have. And when it
Always, always.
comes
How are
down
you doing
to,
in your job? I'm doing
oh yeah,
great.
yeah, I got 100, but ultimately what it comes down to, if during an inspection, if the inspector, if you're dealing with somebody from HIPAA and they want to see and review that, that report, and they see, oh, you got 100 out of 100. All right, well, can you produce this document? Can you produce this? Can you produce? And if you can't produce it, well, now you just dug yourself in a hole, right?
Yeah.
So it's always smarter to do a third party assessment. We've been partnered with an organization called Tano Consultants. And if you're an EPI customer, by the way, you do get a significant discount. But to answer Jose's question, um, we do promote that, and essentially it's going to come through as a task. So it's going to say something on the lines of, hey, if you haven't had your risk assessment done yet, uh, schedule a meeting with Tano Consultants, and that task is always going to essentially be there. Um,
Every user has that button.
no, that's only
So
going to
if
be
I'm like
for
a
no.
basic user,
No. That's only going to be for
okay,
compliance officers that are going to be
okay,
receiving it, or if you're an admin, the person that's in charge of task will be receiving that. Sorry, I didn't clarify
okay.
that.
No, yeah. Same. I assume same with the audit response button on that utilities box.
Same sort of premise. Obviously, ultimately, the sort of bigger picture of using a service like ours, right, is the audit response. And again, we're giving you access to the tool. You guys are putting the tool in motion, right? And ultimately, if you're putting these tools in motion, we're going to have a database of documents, training certificates, business associate agreements on file, right? And in the event of an inspection, yes, we're here to help. There will be an audit response tab, and ultimately what that's going to sort of lead to is you can contact us directly, you can email us, but essentially that's how we manage these things. You hit the audit response, and you contact us, and essentially we'll put together a report based upon everything that you've accomplished on the system, right? Whether that's, again, the training for you and your staff, the policies, procedures, the tasks that you've completed, as well as the business associate agreements. And um, obviously, the size of these reports are variable, right? It depends on,
Yep,
really
yep,
depends on how long you've been with
um,
us, and obviously how much are you accomplishing, right?
yep,
And they could be 5 pages long, they'd be 5,000 pages long, right? Just again, it depends
yep,
on that scenario. But again, we produce those reports, we send them to you. Ultimately, our goal is we want to kill these inspectors with information, right?
yep.
Again, it's going to show them that you're organized. It's going to show them that you're making effort. I would say 99.9% of the time, they might act like they're looking through the information, but like I said, it's crazy that a lot of these inspectors get paid commissions based off the amount of fines they can place on a practice. And when you're killing them with information, what's that term? I want to say,
For
what is
paper,
it? No, it's the juice. Juice is not worth the squeeze, right?
yeah, is the juice ain't worth the squeeze. I'd
Juice ain't
rather go
worth the
someplace else.
squeeze,
Yeah.
and
So,
they're gonna hit your friend next door that doesn't have anything in place, unfortunately. But that's the premise of using a system like ours. Like I said, the main thing is just keeping the stuff in one system. Again, I've seen a lot of organizations as well that try to do, I want to do my OSHA through my medical waste company. I want to do my HIPAA through this company, and why not manage everything through one system? I mean, as a healthcare business, you're already using a million, a million systems as
Yeah.
is.
How many
It's not. And Jose,
passwords
I
and
know you know
logins
this. Yeah.
are you dealing with?
Yeah.
And yeah, it's a mess.
So,
It's a bit of a mess.
obviously, when it comes to the compliance side of things, why not use a system that does it all, right? And that's what
Makes
Epic
sense.
Compliance does. So,
Makes sense. Makes sense. Perfect.
but other than that,
So
we can open up for a quick Q&A. For those of you that have any questions, concerns, please feel free to put them in chat, and Jose and I will be glad to answer.
and while we wait, what's on deck for next week? I forget what
Good
we talked
question.
about.
We talked about a second portion of the HR stuff. I'll get with you on that.
Okay.
Well, I'll get with you on that. We talked about we met with Leah a couple weeks back and sort of talked about the basics behind the HR stuff. And I think we were going to push that needle a little more.
Okay. I just couldn't remember, honestly. And I always like
No
to
worries.
tease a little bit anyway, so.
We knew you were on vacation. It's all good.
Yeah, right. Yeah, right. Oh man. So perfect. Yeah. I mean,
Anybody
I don't think we
got
got
any
any
questions,
questions
concerns?
today.
Let us know. We're here to help.
Yep. And if not, then write it
We need to
down,
discuss
email it
with
to us.
Dr. Headley his all the above answer.
Yeah. 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 Oh man. I know that he was just messing around.
No, he
I'm
was.
hoping. It's
Right, Dr. Headley?
I'm hoping. I'm hoping. Cool,
All right,
cool.
we'll go ahead,
Well,
close
I
it up.
figured
Well,
there wouldn't be many questions today just because it was pretty
yeah,
self-explanatory.
yeah.
But yeah, so I mean, I'm looking
Yeah,
forward to seeing everybody next week.
yeah, Jose, I appreciate you having you on as always, and you guys just look out for correspondence regarding next week's registration and event. Again, if you have any questions, concerns about anything that we've discussed so far, please let us know. Again, one thing I will mention as well, I will be moving forward. I will be the one updating and editing and getting these videos on YouTube. So we almost got these caught up. Again, the correspondence that you guys are going to receive is going to link to our YouTube channel as well. If you want to watch any previous videos of ours, please feel free. And please feel free to like and subscribe to our YouTube channel as well. We are trying to build up that page and create more awareness and value. So again, appreciate everyone being on this. Jose, thanks again. And we'll see you guys on the next one. Okay.
Yep. Good seeing you. Talk to you soon.
Yep. Thanks, Jose. Take care.
Bye.